Okay, what's up guys? So talking about bicep curls, are they a bro exercise? Are they, a rehab exercise? Are they injury reduction, risk reduction exercise, whatever, or strictly just hypertrophy? They're all of them, right? It's funny, right? But I do think that, powerlifters, Olympic weightlifters, of course bodybuilders, but your strength athletes, your strongmen, need to be doing these bicep curls. They are a great way to load that anterior shoulder, the front of the shoulder, right? The bicep, and I'll throw a picture up so you can see, does insert two different places, okay? One will actually go into the labrum, and one's just right in the front. So a lot of times, people get anterior shoulder pain when they're bench pressing, right? Guess what? Guess what's getting pulled on, right? A lot of people think rotator cuff, right? A lot of people think maybe anterior delt. Could be, never not a factor, okay? But my big thing is those structures are all super involved in a pressing motion, okay? And a bicep insertion sometimes is referred to as the fifth rotator cuff muscle. So when you say rotator cuff, it's still not necessarily negating the proximal bicep. So, I get really upset when people are like, "Nah, dude, it's my rotator cuff." Yeah, man, sure, yeah, because it very well could be, right? But it's usually not just one muscle, because one tiny muscle is not the only movable object when you're doing these compound exercises, right? So I really, really think it's a good idea for people to be doing bicep curls in every which direction and having the arm in every which plane as well. So even doing some spider curls out to the side. Some people argue that no, it's not the bicep, it's an accessory nerve coming from the not the paraspinal, but it's a of course I'm blanking. It's a nerve root that is impacted, or yes, of course, blood, because anytime you press on it, it's gonna hurt. No way, dude. You wouldn't be able to get touched if just touching a muscle would cause pain, and that's a silly reason as to why you have bicep pain, or that it theoretically could be bicep pain, right? So refer back to that plane, or the picture of the shoulder. Maybe you can't do a full bench press yet. There's nothing wrong with that. You just got to modify some things, but maybe you can do some, where you sit down on the bench and do some curls this way. Because guess what? This guy gets a little bit of tension, and then you're still getting some good blood flow into that area. Some might say that curls can kind of decompress the elbow and the biceps, particularly the front of the bicep. So doing your concentration curls, right? Doing stuff like that. My big thing is I really like the idea of a drag curl. So you have a barbell, you're trying to almost row it back, specifically using the biceps. Maybe not shrugging up as much as I did there. But some things to think about. But just because you're a strength athlete, you're a strongman, powerlifter, Olympic weightlifter, jiu-jitsu athlete, whatever, even my swimmers, just because you're not necessarily into the physique idea or bodybuilding doesn't mean you should neglect your curls. I don't think they're a brow exercise. I think they're actually very good when it comes to kind of maybe reducing that risk of anterior shoulder pain, depending on how you do it. It can be a great rehab exercise. So something to think about. What do you guys think? Does anybody have any qualms with that? Something just keep in the back of your head, okay?